Hello, my name is Christopher South, and for I guess the rest of the semester, I'm going to be posting videos that are going to explain some of the topics that are found within the ANP2 course and relate them directly to what's going on in healthcare right now. I've been a paramedic for 30 years. I currently work in the emergency department at a critical access hospital, and every week I'm going to talk about some of the things that we're learning in AP and show you how it has a direct correlation with what you're going to be doing in healthcare. So today it's going to be just a little bit different. So I'm going to be talking from a healthcare perspective, but also from my own perspective. As today, what we're talking about in the endocrine system is something that affects me every single day. And I'm talking about every day. Every decision of my life is because, unfortunately, my endocrine system doesn't work the way it needs to, is because I have diabetes. And that means that my pancreas just does not want to work the way it does. So let's talk a little bit about diabetes and what it is. All right. So you have different types of diabetes. All right. The one that most people are pretty commonly know as is what's known as type 1 diabetes. All right. So type 1 diabetes is the beta cells, all right, which are found within the pancreas. Those beta cells are not functioning the way that they should, and actually those beta cells are not functioning correctly, or sometimes it actually causes destruction of the beta cells, and the beta cells actually create insulin. And insulin is important is because insulin is what allows glucose to go into the cells, and that's what creates ATP. Very, very important. In type 2 diabetes, all right, this is typically, now with type 1, it's more associated with like kids. It's typically when we start to see type 1 develop. Type 2 develops later on in life for most people, especially in adults. It used to be called adult onset diabetes. Type 2 diabetes, now you got to remember that the body is still creating insulin, but that insulin, it may not be producing enough insulin. It may start off at first creating a good amount of insulin, and it's not creating enough insulin, and then eventually that insulin becomes resistant. That means it doesn't work as effectively as it needs to. But there's lots of different medications, there's diet changes and stuff that can make managing type 2 diabetes a little easier, but some patients will eventually need to go on external insulin to be able to function. Now, there's a couple of more diabetes I want to talk about. We have prediabetes. Now, prediabetes basically means that that patient is starting to experience elevated levels of increased glucose in their bloodstream without it getting to the level of diabetes. And a lot of times it's a warning sign that diabetes is about to occur, and that's especially for folks that are leaning more towards type 2 diabetes, is that they need to make some lifestyle adjustments to get their glucose under control. Now, in pregnant females, you got to remember that there's lots of hormonal changes that are happening, and one of those hormones that can change is definitely changes within insulin. And so these patients can get what's known as gestational diabetes. In gestational diabetes, what happens is they develop symptoms of diabetes that resolves after pregnancy. So that's a good thing. You get temporary diabetes is what I like to call it. But one of the things that I did not find the material that I would like to tell you about is something that I have. All right, and you may have to look this up on your own to see if it's a real thing or not. And this is called diabetes type 1.5. You go, what's type 1.5? Type 1.5 is also known as LADA, L-A-D-A, which stands for latent autoimmune diabetes in adults. So what this is basically where we have type 1 diabetes that develops later on in life in adults. All right. Oftentimes it is misdiagnosed as type 2 diabetes, which is what personally happened to me. Is for a number of years I was mistreated as type 2 and ended up making my diabetes a lot worse, and I had some complications to it until I was finally diagnosed correctly with type 1.5 diabetes, and I was put on external insulin via an insulin pump, and my life just improved so much. So talking about that, so if we know about our hormones that happen inside from the pancreas, I want to talk about two of them specifically, all right? I want to talk about ones that get produced by the beta cells, which is this little guy, which is insulin. So what insulin does, you see my little bottle of insulin, it goes into my handy dandy insulin pump right here, ta-da, is insulin, basically, and when I try to explain it to patients and everything at the hospital that I work at, is insulin's kind of like the door guy. He opens the door and lets all the sugar guys go into the cell, and that's how he's supposed to work. Now, sometimes, for me, my door guys aren't there, so nobody's letting the sugar in, and the sugar's running around doing crazy things inside of my body. And sugar can be very destructive inside of your body if it's not going to the cells. It tends to do bad things, causing neuropathy. It can cause problems with your eyes, problems with your kidneys, your heart, all kinds of bad things. So that's why I want this stuff to open the door and let all that sugar go into the cells, where it can create that good old ATP and give me all the energy that I need. And so since my beta cells aren't functioning correctly, I have to get this externally. Now, let's say that I give myself too much insulin, and that has happened before, is because in having diabetes where I'm having to put insulin externally into my body, it doesn't work as well as my pancreas does. And so it's not in real time, one-to-one, like your pancreas works. And so I'm having to balance what I think I'm going to need versus what I need. And so what that means is I have to balance what I think, how much food that I'm going to eat, on how many carbs that I'm going to eat, and I'm going to have to adjust my insulin level based off of that. And sometimes I don't get it quite right. Sometimes I give myself a little too much, or sometimes not enough. And so sometimes that can cause hypoglycemia. And hypoglycemia is low blood sugar. All right. Now, if it gets severe enough, that's where another really important hormone comes in, and that is called glucagon. Now, glucagon is produced by those wonderful alpha cells that happen to be found in the pancreas, and those alpha cells go to the liver and make glycogen come out of the liver, and that actually brings up my blood glucose levels if it gets low. Now, in emergent situations, let's say for some reason that my blood sugar gets incredibly low, all right, my alarm's going off, the wife and the kids are scared because, now I've gotten to the point where I'm going into a diabetic coma, as I'm no longer able to eat or drink anything. I've gone past that point. There is an emergency way to get my blood sugar up temporarily, and this is through glucagon. And so this little pen right here looks a lot like an EpiPen, has glucagon in it, all right, just like it has inside of your pancreas. And so they can inject that into my stomach, and it will go in, and it will release that glucagon, which will go into the liver, and it will release glycogen, and it'll raise that blood sugar up temporarily if there's enough of it in the liver to get that blood sugar up enough for me to come back responsive enough to be able to eat and drink everything. And this is for emergency use, and unfortunately we have had to do that once before. So diabetes can be a difficult thing to manage, but it's cool to think that when some of the hormones that are found in your body don't work correctly, that medicine has come a long way, that we can actually produce artificially some of these hormones in a lab and be able to inject it into a patient to work artificially for patients who don't have that, patients just like me. All right, so we're now just learning about hormones and everything. So the next episode that I'm going to do, we're going to take it right from inside the emergency department, and I'm going to show you some cool stuff that we have in the ER, as we're going to look at some of the hormones and how those hormones, we're talking about ones that we can inject into a patient to make things work. We're going to look at a couple of things like epinephrine and norepinephrine and how they work in the emergency department, that they are hormones, and how we can use those to raise a patient's blood pressure, get their heart pumping back effectively. And so some of those are the cardiovascular drugs that we use that are hormones that we inject externally into a patient to get them back going to where they need to. So for all you nursing students that are out there, make sure you pay a lot of attention to the endocrinology chapter, because many of the drugs that we're going to be giving our patients work to either stimulate or decrease some of these hormone activities in order to make changes within the body. So this is your happy dandy local paramedic, Christopher South here, and I'll see you guys soon.